Hey there, my name is Stephen Shaw, and today I wanted to talk to you guys about electrical muscle stimulation. Some of you may know it as neuromuscular electric stimulation, or as TENS, which stands for transcutaneous electric nerve stimulation. Basically, these are the elicitation of desired muscle contraction using electrical impulses from a source. So the basic gist is that there is a device that generates an electrical impulse and sends it to the patient through these wires. The impulse goes through these electrodes that are strategically placed on the skin near the muscle that needs to be contracted. EMS is an essential tool for many physical therapists today. It can be used to strengthen atrophied muscles, as shown by this lady's left calf being much more atrophied than her right. It can be used to stabilize muscles, as this therapist is using to stabilize this patient's shoulder. And it can be used to strengthen muscles that are already strong for greater performance, such as this man's abdominals. Most modern-day devices use something called a symmetric biphasic current. As you probably know already, an electric current is a flow of electric charges, usually electrons, pushed along by the electromotive force, which is created by an electric potential difference. This electric potential difference is created by a set of batteries in most devices, but can also be produced by a generator shown here. These devices use the voltage created by this difference and channel it into two electrodes. This voltage is also used by the device to produce symmetric biphasic waves of impulse or currents. It works by applying an alternating negative and positive pulse in one electrode and the other, and constantly inverting the pulse so that the charge does not build up and cause burns to a patient's skin. This is the preferable way because many membranes of excitable tissue, such as the nerve and muscle cells we are targeting, will pass current into cells most effectively when an applied voltage is changing or alternating, as shown here. This makes it the most comfortable way for many users and is best used for large muscle groups. Skin is similar in that it passes more current when the voltage is changing, so the alternating current is the most efficient and least resistant way of delivery. So as mentioned before, the electrodes apply alternating negative and positive phases. Two phases together make up a pulse, as shown by the pulse duration diagram here, which shows the time frame for one pulse pair. The amplitude of the phases are the same, it's just that one is positive and one is negative. And these amplitudes are determined by the voltage delivered through the EMS machine, which can be controlled through dials. Basically, this first phase is usually positive. This sets off a refractory period in the muscle, as shown by the interphase interval here. This refractory period is a time period when the fibra will not be stimulated by any amount of stimulus. As soon as this phase is over, the negative phase is sent to the fiber, and this is what actually excites the fiber so that the muscle will contract. These pulse pairs are repeatedly symmetrically generated over and over again back and forth between the electrodes over a given time period. Usually there are about 60 cycles of voltage change per second. So there's a constant bidirectional flow of electrons to each electrode, as shown by the negative and positive phases. The images are mirror images because they are symmetrical. Since they are this way, there is no net charge, therefore there is no buildup. For EMS to work properly, there must be a completed circuit, and in the case of EMS, there is usually a series circuit completed with resistances by skin and bodily tissues. This total resistance added to by the skin and tissues is called a load, since these tissues conduct electricity. So the voltage comes from the device, travels through the skin on the electrode, to the bodily tissues and the excitable membranes that we are targeting. Then it comes out again through the skin and back to the EMS device. So you may be wondering, yeah, the body conducts electricity, but how does that make our muscles contract? To answer that, we will go to the brain. So when we want our muscles to contract, it starts with our central nervous system in our brain. Our brain sends an electrical impulse through some fibers to the spinal cord, and from the spinal cord more fibers branch out to the muscles that need to be contracted. It starts when an electrical impulse sends from the brain through these fibers. Now on these fibers there's an action potential because there are more positive ions on the outside of the cell than inside. When this electrical impulse comes along down the fiber, it causes these positive ions to rush into the cell. As this happens, it triggers this action potential to happen further and further down the nerve fiber until it comes to the muscle. When these little synapses on the muscle receive this information, they release something called a neurotransmitter, which is basically a chemical of the body that transmits information. This neurotransmitter creates chemical reactions in the muscle that eventually help the muscle contract. There are many variables when it comes to electrical muscle stimulation, such as the differing degrees of stimulation. These differing degrees are used to get different results in a variety of patients. The degree of stimulation needed depends on several things. If we have a patient who is large and has thick skin, more stimulation will be required to break through all that resistance compared to someone with a smaller frame or more thin skin. It also depends on what muscle group is being targeted. It will take more stimulation to work on back muscles or leg muscles than muscles in a hand or foot. This is because back and leg muscles are much thicker and cover a larger surface area than hand and feet muscles. It can also depend on how much the person can tolerate, which is why a therapist must start slowly with patients who are new to electrical muscle stimulation. It allows them to see how much stimulation is too much and the range in which the patient will be comfortable, and still getting a desired result from the treatment. So patient tolerance is the #1 priority. There are many different effects when it comes to EMS, some short, some long. Some short-term effects include pain management, day-to-day wound care, medication delivery through patches and electrodes, and stimulation of degenerated and atrophied muscles. On top of the short-term effects, there are many more long-term effects, since you have to continually use EMS to get good improvement in many muscles. These include improved circulation and relaxation of muscles, enhanced muscle recruitment, facilitation of weak inhibited muscles, reverse of atrophied muscles, motor relearning, muscle strengthening, increase in range of motion of joints, reduction of muscle spasms, fracture healing, replacement of orthotics, reduction in scoliosis, and longer-term pain management. Placement of the pads or electrodes is ultra important in getting specific desired results in patients. Placing the electrodes in random spots on the body can help, but will not do near as much good as properly placed electrodes. This ensures that the targeted muscles are getting the brunt of the impulse and other tissues are not being affected or damaged in any way during treatment. The better the pad placement, the more direct the impulse and the greater the result. So pad placement, choosing of muscle groups, rate of stimulation, and force of stimulation from voltage all come together on the patient to elicit a desired response and outcome. On this slide we see proper electrode placement on abdominals, ankles, and quadriceps. As you can see in this case, there are positive and negative electrodes. This means the impulses would come into the positive ones, go through the injured area or targeted area, into the other electrode, and out. This slide also shows more proper pad placements for your lower back, calf muscle or gastrocnemius, and your bicep muscle in your arm. As I said, rate of stimulation and force of stimulation also come together on the patient. So for someone who has a shoulder pain injury, you would want to place the pads around the hurting muscle, shown here, and use a slow massage of pulses at a low current to help the muscle relax and ease its tightness. For someone who has had a neurological accident and has possibly lost the ability to use a leg, you would place the pads around a large muscle group of the leg, such as the quadriceps shown here. And you would also use short bursts of pulse at a high voltage or force to help the muscle remember how to fire and contract properly. For an athlete who wants to get stronger, you would place the pads near larger muscle groups, as shown here again by the quadriceps on this athlete who is currently squatting. You would also use medium pulse frequency and a higher force of current so that the muscle has to continuously work, leading to strengthening of the muscle. So in conclusion, there are many uses for electrical muscle stimulation in the physical therapy world, and it is all thanks to the physics of electricity. Thank you.